Hi, I'm Dr. Giles, and today I wanted to explain to you a little bit more of what IgG test is. The IgG is a test that will check for antibodies in your blood towards what you're eating. So when you have semi-permeable turning to hyperpermeable, you're leaking toxins and food through your system, that over time, the IgG antibodies, which are the most abundant antibodies in your system, will attack those foods, and you'll end up getting inflammation from the attack of those foods. And what's important is to find out what foods you are being sensitive to, not necessarily that you are allergic to. The allergen, the IgE antibodies, those would be another test we could look at to see if you're allergic, as far as if you eat gluten and you're celiac, you are having an IgE reaction, which means you're going to be on the ground and writhing in pain. That's an IgE reaction, where IgG is more chronic. It's more inflammation. It's more exposure after exposure till finally you have an issue. So with the IgG, what we're doing is we're going to take a blood sample and we're going to mix it, or we're going to put it into this little vial. The little vial is the one with the red top. It's going to go into this little foam rubber, and it goes right into this little square, and that's so it can hold on top of your table. Now, as you prick your finger, what you'll do is you take this off. You take this little purple tab off. You just turn it and peel it off. Now, after you've wiped your finger with your alcohol, you'll put this against your finger, and you just press the purple button here, and a little lancet will come out and prick your finger. The test includes 3 different lancets in case you're unable to get the hole will seal off, so you don't get more blood out of it. But as you're now trying to get this to bleed, you're going to just come down your arm and into your hand, and you'll notice you'll start to get a little droplet there. What you're going to do is take the lid off of this, and the lid, now that you've got a little droplet of blood, you can take the little top there, and you just scoop it right across that little blood marker. And then you're going to come down, so this will go back onto your table. You're going to come back down and bring more into it. You can just keep milking more blood, and sometimes you'll be able to bring it to where you've got an actual droplet of blood, and you can just hit it into there. What we're trying after, you can see the bottom of the tube is right here. We need to get enough blood to fill to that first line. So if we can fill up to that first line, make it past the first line a little bit till there's adequate blood. And it takes some time to do. Make sure that the day you do this, you're well hydrated. Make sure you drink enough water the night before so you're well hydrated. You can also stick your hand into hot water, and that'll bring blood flow to the area as well. But if you need more, there's 3 lancets. You just keep milking that in there. So then at the lab, they will take this the blood, and run it through the course. And what it does is it gives us a lot of findings. So what we're looking at is anything, normally you're going to be less than 5. So these are all negative. But if you look up here under egg and milk, this particular person has a lot of milk issues. So 37 for cottage cheese, cow's milk at 38. So these were their 3s. That means that you don't want to have any of these foods for about 3 to 6 months, so that the IgG antibodies can diminish. Over here, look at this one here. This is egg white at 41 and egg yolk at 46. 50 is the highest that it goes. So this person should not be eating any of the eggs. But meat looks pretty good. Fish, that looks really good. All the vegetables, those are all 0s. Spices, that can't eat paprika, that gives them a 20. Over here, ginger, almond milk, so almonds would be out. But overall, it checks for 280 different tests, different foods that you could be eating. And if there's any inflammation, if there's any IgG antibodies affecting it, we want to take that food away for about 3 to 6 months so that the IgG will drop. And then in the meantime, we'll be looking at the microbiome, getting rid of infection, so that semi-permeable membrane can diminish and become semi-permeable versus hyperpermeable. We want to get that hyperpermeability out of there. So we want to find out what you're allergic to, in foods, as well as getting rid of the life forms that are abnormal in your gut. That will diminish the inflammation. Amazing results will happen. Inflammation drops, brain fog goes away, joint pain diminishes, your gut swelling diminishes. Overall, you'll feel much, much better. So I hope that helps. And if you have more questions, feel free to contact us here at the office.